All right, welcome back. Today we're going to talk about restriction of IV fluids in ICU patients with septic shock, aka the classic trial. My name's Mike Freilich. I'm a general internist and clinician scientist here in Toronto. Let's walk through the design of the study. I like to use the framework for PICOT to understand the research question. So this included patients, specifically adults in the ICU with septic shock, who've received more than 1 liter of IV fluids. They were randomized to intervention group of restrictive fluid, a bolus of 250 to 500 mLs, and the comparator arm was standard fluid. So no quantity limit given, really up to the physician who was caring for the patient. The outcome was death, and the timeline was 90 days. And then to understand sort of the design, its strengths, its weaknesses, I use a PHOBIA mnemonic. So was it placebo-controlled? No, that's of course problematic. How is it funded? Not by industry. Outcome clinically relevant? Of course. Was it blinded? No, that's problematic. Intention to treat analysis? Yes. And were there a lot of centers? Was this a multi-center study? Absolutely. So let's talk about the findings. Of the 2,000 some odd patients who were eligible for this study, 1,500 were randomized. Loss to follow-up was rare, which is ideal. In terms of the baseline characteristics, average age was 70, 50% male, 50% were on respiratory support, such as being intubated and ventilated, average creatinine of 141. Median fluid received 24 hours before randomization was 3 liters. That's important. And then among the individuals who were randomized to the restrictive fluid group, they got 1.8 liters compared to the standard fluid group, which was almost 4 liters. So what did they find? Well, their primary outcome, as you can see, no difference, okay? No difference in the risk of death at 90 days for the two groups, almost identical at 42%. In terms of secondary outcomes, no major secondary outcomes that showed clear benefit or harm. Similar number of individuals who are alive and without life support, similar rate of serious adverse events. Limitations. So as noted, all participants had already received a decent amount of fluids before randomization. Lack of blinding, of course, is another limitation here. Overall, for ICU patients with septic shock, there's no significant difference in 90-day mortality between individuals with restrictive fluid versus standard fluid therapy. For me, is this practice changing? I don't know. For a while, I thought give lots of fluids, and then I thought, geez, maybe less fluid is better. And now this suggests maybe they're the same. For me, I'm biased probably towards giving less fluid rather than more. Thanks so much for listening.